Hello, in this video I'm going to discuss the importance of maternal mortality as a measure of how we care for pregnant women and mothers. Before we start talking about maternal mortality, I need to define some important terms. Maternal mortality is the phrase used to describe the death of a woman while she is pregnant giving birth, or a pregnancy-related death after she gave birth. Such deaths are rare. About 100 times more common are near-miss events that could have led to death. Examining mortality and morbidity of pregnant women and mothers helps us analyze the success of their care. Worldwide, there's been a lot of success with combating the death of mothers. Researchers at the Global Burden of Disease Maternal Mortality Collaborators have found that globally, maternal mortality has fallen by 30% between 1990 and 2015. Much of this progress came from preventing deaths from things like infection and hemorrhage in developing countries, but progress can still be made by helping poor women access more quality health care. These researchers found that 169 countries have decreased their maternal mortality rate since 1990. However, 26 countries saw an increase. The United States is one of these. We're a very diverse country, with each state having different populations and public health policies. Importantly, many states in the country have not acted to stop maternal death. This has resulted in rising maternal mortality. The CDC reports that the maternal mortality rate in 1987 was 7.2 deaths per 100,000 births. Since then, by 2013, it has ballooned by 140% to 17.3 deaths per 100,000 births. The Maternal and Child Health Bureau estimates that over the past decade, maternal morbidity has increased by 75%. These changes in maternal mortality and morbidity indicate that something has changed with how the United States addresses maternal health. What has changed to make America one of the only developed countries in the world where maternal death is on the rise? One of the things that has happened is we've become better at tracking maternal death. This was achieved in part through the addition of a pregnancy box on the standard U.S. death certificate in 2003. This could explain some of the increase in numbers, but it doesn't explain the fact that maternal mortality continued to rise after the box's addition. As the United States population leaves rural areas, healthcare providers also leave. For example, Dina Fine-Marin of Scientific American reports that since 2010, 80 rural American hospitals have closed. This makes it so that rural women have a harder time making it to hospitals for checkup visits and might not even make it to a hospital in time for birth, sometimes giving birth on the side of a road. Fine-Marin notes that this lack of care makes it so that the maternal mortality rate in metro areas is 18.2 deaths per 100,000 births. In rural areas, it is 29.4 deaths per 100,000 births. Unlike the poorest countries where maternal death occurs from events directly caused by pregnancy, maternal death in the United States is becoming increasingly linked to worsening health. As conditions like obesity, diabetes, and hypertension rise, the maternal deaths that are related to these rise. The opioid epidemic even affects maternal health in the United States. Use of opiates not only adds a risk of overdose, but it makes a woman generally less healthy and able to deal with pregnancy. Furthermore, severe opiate addiction makes it so that a woman might not go to a hospital for all of the treatment she requires during pregnancy. Another element of the rising maternal death rate is the reproductive choices American women make. When a woman ages, a pregnancy becomes riskier for her and the baby. As women in America choose to have babies later in life, they may inadvertently be putting themselves at higher risk. Furthermore, the high rate of voluntary C-sections in the U.S. makes pregnancy riskier. One of the things that can result from a C-section is a condition called placenta accretia, where the placenta sticks to the uterus and may cause it to tear during later births. In the 1950s, this occurred about once per 30,000 deliveries in the U.S. Now it occurs about once per every 500 births. This change shows how the rising rate of C-sections made pregnancy more dangerous in the United States. One of the most startling facts of maternal mortality in the United States is a severe inequality in the numbers. Black women are 243% more likely to die of pregnancy-related causes than white women. This is one of the biggest racial health disparities here in the United States. According to Renee Montagne and Nina Martin at ProPublica, Black women are 22% more likely to die of heart disease, 71% more likely to die of cervical cancer, but 243% more likely to die of pregnancy-related causes. There's a lot behind this. For one, Black women are more likely to be uninsured than white women. A lack of insurance can mean that women might not be able to get treatment for conditions that could make pregnancy more dangerous. It might also mean that they have less access to birth control, which could be useful in preventing a risky pregnancy. Because Black women are more likely to have conditions like obesity, diabetes, and high blood pressure, their pregnancies tend to be more dangerous. These differences in health are linked to factors of inequality like health insurance, food deserts, quality of healthcare, and more. Researchers examining the role a hospital plays in maternal mortality and morbidity have found that high Black serving hospitals have 67% higher rates of complication than low Black serving hospitals. This shows that the hospitals that serve large Black populations might not be as well equipped to ensure safe deliveries. The reasons behind this are not yet fully determined. However, these researchers noted that 75% of Black deliveries were performed at only a quarter of hospitals in America. Improvements in care at these hospitals would likely help mitigate inequality in maternal health. As with many other issues of inequality, racism plays a role. Arlene Geronimus, a professor at University of Michigan School of Public Health, developed the term weathering to describe how day-to-day racism can wear down the health of Black Americans. The constant fight and stress that comes from confronting racism in daily interactions likely contributes to the overall poorer health of Black Americans. This poorer health makes Black women less likely to have a successful pregnancy. Furthermore, Black American women must also fight the less overt cousin of racism, implicit bias, while receiving care during pregnancy and birth. Journalists Nina Martin and Renee Montaigne at ProPublica note that many Black women report being perceived as poor, uneducated, uninsured, and an adversary, not a partner, by their healthcare provider. Even if it is unintentional, implicit bias in healthcare is an important issue of inequality in the United States, and its consequences are apparent in the differences in maternal mortality. The factors behind rising maternal mortality make it seem like the rise is irreversible. However, the actions of Texas and California show that even a state government can do a lot to affect maternal care. This chart shows a staggering difference in maternal mortality between America's two most populous states. As you can see, Texas has risen significantly between 2010 and 2015, while California's maternal mortality rate has halved. These changes can be explained by the actions each state has taken to address women's health. In California, between 2000 and 2006, the maternal mortality rate more than doubled. To address this, the California Maternal Quality Care Collaborative was founded. Their strategy involves addressing the most preventable causes of maternal death by partnering with hospitals to establish clear guidelines and strategies for treatment. An example of one of the things CMQCC implemented is a hemorrhage protocol to quickly treat the bleeding that can lead to death. They created hemorrhage carts, similar to crash carts for heart failure and other protocols for hemorrhage. Hospitals that joined CMQCC saw a 21% reduction in hemorrhage-related complications, while California hospitals that weren't in the program saw only a 1% reduction. They also reduced the C-section rate in the state. Though the effects from this won't be seen immediately, it will make later deliveries much safer. Though they have made a lot of progress in maternal death, doctors involved in CMQCC admit that the problems of racial inequality and rising chronic conditions are challenging to address and still need improvement. Texas, on the other hand, seems to have taken the opposite approach. In the state's continual attempts to curb abortion, they seem to have weakened women's health care. In 2011, they cut $73.6 million from the state's family planning budget. Then, in 2013, Texas passed House Bill 2. This required abortion centers to make a lot of changes to their practice, which resulted in a lot of these clinics closing. The important thing about the family planning budget and the clinics is that they did more than provide abortion. They also provided care to women without access to regular health services. Though House Bill 2 was overturned by the Supreme Court in 2016, many of the clinics that closed have not reopened. Furthermore, the Texas state government has opted not to adopt the Medicaid expansion that would help cover the very poor in these states. These factors and many more have resulted in an ever-increasing rate of maternal death in the state. The actions of these states illustrate the role government can play in preventing maternal death. Pregnancy and childbirth-related death in the United States only results in about 700 to 800 deaths per year. Though these numbers appear small, they are an indication of how we care for pregnant women and reflect the health of our country. The rising rate of maternal mortality shows that the United States is failing to sufficiently protect pregnant women. There isn't a single cause of maternal death. Factors like the woman's health before her pregnancy, the care she has received before, during, and after her pregnancy, the quality of hospital she has access to, her health insurance coverage, the state she lives in, and her race can all affect the probability that she will suffer death or complications. Importantly, all of these factors are linked. To address rising maternal death, attention must be paid to each of these. The inequality between Black and white maternal outcomes in the United States is another reason why this issue is so important. Though this is somewhat explained by the poorer health of Black women, the disparities in health coverage, and implicit bias are all linked to the United States' seemingly intractable problem of inequality and racism. The differences in maternal mortality between California and Texas show how a state can make deliberate changes to affect this problem. The question is whether a state or our country will place a high enough value on the woman at risk of dying to make these changes. Thank you for listening to my presentation. Here is my works cited. Thank you.